And I think we are live, but we're doing this on faith because we are here at the AHP conference in a hotel suite in order to bring to you 3 leaders in the field. And that's going to mean we're doing a little bit of MacGyvering in terms of our tech here, but we're very happy to have you here. We actually don't know who's in the room with us this time, but we do want to encourage you to participate actively. I will have notes on my phone if you do have questions. And of course, the chat is a perfect place for those who are here with us live to talk with one another, which is one of the great parts about this field, is that we have a chance to get to know one another and to share ideas. And today, there will be a lot of idea sharing, but some of those ideas will come from you. So please do, as I can see at a distance, some are already doing, and just say hello and maybe where you're from, which part of the country or the world that you're from, perhaps which organization you're with, and just get to know one another a bit. The questions, however, please do put those in the Q&A. That will ensure that they eventually make their way across the room into my phone so I can share them with our panelists today and see if we can get some answers for you. Now, of course, this is how to raise. That means that this is CFRE accredited, so if you're collecting those credits, do put this in your list. But also you can see a recording of this and share it with your colleagues who can't be with you live by going to the website of our sponsor, long-term sponsor, DonorSearch, where under the resources tab, you can see literally hundreds of recordings of these sessions. But this one, which is a special one, will be there probably in the next 48 hours. So stay tuned for that. There are no slides today, so please don't ask about the slides. This is a chance to actually have a real, live, robust conversation in the place where it all happens, which is AHP, the Association for Healthcare Philanthropy, and we're doing that with 3 true giants in the field. So I'm going to introduce them all to you. And I have a little bio so I don't leave anything out. Of course, we have right here Alice Ayres, who is the CEO of AHP, and she's representing this organization, which now I think has over 7,000 members? 10,000 members. Yep. Okay, this is exactly why we do the series, so we can get corrected from across healthcare philanthropy. And I had the privilege of interviewing a few of those folks just yesterday, some of those who are being honored as fellows. And they are across the country, but around the world. So it's really a really impressive organization. Obviously, one of the most influential voices in this field. So it's a pleasure to have you. Thank you very much for taking the time.
Thank you.
Of course, we have Betsy Chapin-Taylor, who has been here before with us, sharing a little bit in this series, but also on the podcast. And if you don't know Betsy's work, shame on you. But Betsy is the CEO of Accordant. But you can learn more about Accordant, and I hope you will, as well as AHP, by going to the Accordant website and to learn all about their services in terms of really helping healthcare organizations make the leap into transformational giving. Their counsel is truly transformational itself. So thank you, Betsy, for being here. And then, of course, our friend, and not coincidentally also the sponsor of the series, but someone who's been in this field for quite a while and knows various aspects of it, but especially the tech that contributes to the advancement of the profession of fundraising overall, and especially healthcare fundraising and healthcare philanthropy, and that is Sarah Tedesco, the COO of DonorSearch, and I guess we're calling us DonorSearch at EverTrue. Yeah. I'm trying to get the lexicon right, but thank you very much, Sarah, for being here to contribute to this conversation. Appreciate it.
I'm honored to be with you all. So
yeah,
thank you.
Absolutely.
And Jack is in the background to ensure that you can hear all this. So if you have any trouble hearing or seeing, do place a note and he will let us know what we need to do to modify things for you. Now I have some open questions about the session, the sessions that we've seen here at AHP this year, but this is really a chance just to talk about kind of the state of healthcare philanthropy. So maybe a way to start with that is to just ask the group what kind of shifts you see in healthcare philanthropy this year, or maybe even frame that about where it was as well as what is happening now that really makes it truly special. I know you had a session just this morning on this topic.
Yes.
So, but talk about that or not, but where are we?
So first, thank you again for inviting me. It's always fun to be with such wonderful people all the way around, and I'm really excited that we get to sort of carry the conference out into the rest of the world today as well, too. So we really appreciate it. You know, I think your question, and we sort of talked about this a bit beforehand around whether it's financial or whether it's, you know, headwinds from the regulatory perspective or from the federal perspective. There's so much coming at healthcare in so many different directions. And I've heard so many people say, gosh, I don't even know where to look or what to focus on because there's just so much. And I think the smart people, both in healthcare and also in healthcare philanthropy, are saying, let me focus on what we can control. And one of the big shifts, which I think is really exciting for us, is that all of a sudden, the fact that we are a powerful, reliable, diverse revenue stream in the midst of operational margin meltdown is suddenly being really noticed by our C-suite partners. You know, when I first started this role, and Betsy was actually on the committee that interviewed me, one of the questions that sort of always haunts me from that conversation was, how do we get our CEOs and others to engage in the work of philanthropy? And I feel like because of all of the headwinds, because of everything coming at us, all of a sudden it's really clear that they are beginning to recognize that we need to be a strategic partner, that we need to be in the room, and that we are a critical component to being able to make sure that we survive as a sector, as a healthcare sector, and are able to support our communities in the right ways. So there's a lot of doom and gloom, there's a lot of stuff that people are scared of, but I actually think it's a really exciting opportunity. And I think understanding that now is a moment when you can really lean in and teach your colleagues about what we do and have real effect is super exciting. So that's the thing I would point to, honestly.
And you had a couple things embedded in there, which are really interesting to look at. And one of them is headwinds. And for those who maybe aren't familiar with those headwinds, maybe we can discuss that. I don't know if you want to take that as a departure point, Betsy, or?
Yeah, I mean, I think I even want to lean into where Alice just said, like, suddenly healthcare organizations do have a keener understanding of the fact that they need healthcare philanthropy. Where I think I still have concerns is a lot of them have arbitrary expectations of what philanthropy could do for them. And so I see a lot of organizations that they're saying, you know, we want you to raise 1% of our annual operating revenue for our hospital. And that's a completely arbitrary number. It is pulled out of the sky. And I think that they need to understand that philanthropy is something that is enabled by a variety of things that move together in a value chain. And so not only do we have to want money, wanting money is easy, we have to have a vision that is worthy of investment, that is well articulated, where we can share what the impact is. Most healthcare organizations, frankly, do a very poor job saying what they want to raise money for. And we could talk more about that. They have to make sure that their organizations are staffed appropriately. These are relationships, and relationships require humans. And so we need to staff our offices appropriately for us to go out and foster interest and ownership in our organizations. We need for there to be adequate budgetary investment. There needs to be positioning in the organization. We need to recognize philanthropy as something that is valuable and culturally aligned. And so I'm glad that there's attention on philanthropy right now, but we've got to build the ecosystem in which it can thrive in order to really optimize its ability to impact the future of healthcare.
There's a lot in there too, and I know we can talk about that all day, but the 1% really hit me. It's in so many ways. And so Sarah, let me ask you this question. Not only working with lots of different kinds of clients, healthcare, also non-healthcare, but also being at a business that has to look at where are the opportunities and where are they not. When you hear 1%, how excited can you get about 1% of the revenue?
It's interesting when you say it's arbitrary too, because like in their mind, they think, you know, it's goal setting, it's motivating, you know, it's something to strive for. But when you think about like the KPIs and the metrics that are set, it's like, how do you get there? What are the different tools or solutions that are going to take you to that? And what sort of team of people do you have? So I think, you know, when you're thinking about these new goals, these new metrics that you have to track, you have to really pinpoint, well, what are they? What does that mean? Who's going to get me there? And what solutions do I have that will take me to that goal? And that's definitely something that we look at on a daily basis, but of course our clients. And I think, there's an opportunity to get people super excited, to get people motivated when you show successes, right? When you hear about the different stories, when, you can show, from our perspective, how technology makes life easier for you and how it can, alleviate some of those stresses of getting that 1%, but maybe you can actually do more, it's like 1%, maybe that's not enough. Like,
Right.
you could do something that's 10%, we hear all different kinds of stories that talk about that. But yeah, I think that's, go ahead.
Well, the other thing I was just gonna say, and it sort of dovetails somewhat, Betsy, with what you were sort of pointing to, is the idea that we can suddenly say, we're gonna raise this much, the goal is this arbitrarily,
Right.
not supposed to bang on the table, was, can't help it sometimes. The problem is that I think one of the ways that we're talking about this moment is we're in trouble. The dollars are going to go to, not quite keeping the lights on, but sort of that's the vibe that I think some organizations are giving to their communities. And Dan Pennington, actually, this morning on the panel, he's at Vail Health, said, we have to continue to say, these are the needs of the organization. We're hearing that from our C-suite. These are the new needs that we've got to focus on raising money for. But we have to turn that into a vision. We have to turn that into a dream. We have to turn that into something that inspires a donor, because donors don't give to needs as much as they give to be a part of an inspiration. And so even more than normal, because the need feels so intense and so urgent right now, we've got to be good stewards of that story and of that message and sort of pivoting it over to an inspirational one for donors.
Absolutely. I think no donor wakes up in the morning with their purpose being to backfill our budgets.
Right.
and
Toilet
so
paper and light bulbs are not super sexy.
yeah, and so I think like when we go out with a need conversation, despite all the constraints, despite all the challenges, we can't go out and say, we are needing you to fund our core operations. And I think most donors, frankly, are not giving to the healthcare organization. They're giving through the healthcare organization. And so we need to understand that our organizations must be positioned as conduits or catalysts to elevate the healthcare of our community. But we are only a mechanism. When we go out and make the story about us, and about what we need and about what we want, I think it is a case that falls flat. The missional position is how we are asking people to gather around us to elevate the health and well-being of our community. And so it is focused on their needs, their outcomes.
I know that this is something we talk about in fundraising all the time, especially in capital campaigns, and finding that group of people for whom the mission and the vision. So not only where we are and what we do, but what we plan to do for the future. Then that's really important, especially for people with significant resources. This is something I know you track.
Yeah. Well, and I was going to say too, it's present in healthcare and it's present in all kinds of different industries, right? And you think about the landscape of hospitals right now and all the different mergers and acquisitions and people trying to figure out, what is our purpose? What is our goal? We have this culture over here. We have this culture over here. And, even at DonorSearch, right, with our new merger with Evertrue, we're very much in alignment, but we still get questions. Well, what is the vision? How are we going to work together even so they're so closely aligned? So I think it's really important, like that communication and still having that human connection, which, we all talk about. But again, it's like if you have the team in place, you have the strategy in place, you have the solutions that are going to help you get there, you're going to feel a lot better about having those communications, that human connection, and being able to, put your best face forward and being able to, really have that empathy for folks that are either on your team or even the donors that are questioning, like, what is the value? What is the vision here?
It must be really hard when you think about it. And as you said, you're going through this transition right now because of the acquisition, the merger. But one of the things I heard definitely interviewing all these people within AHP this week was about these hospital systems and their growth. And part of this is what you were talking about before about headwinds. How do we stave off some of the pressures that we have? and maybe create some efficiencies so that the percentages, even if it's 1% or 2% or whatever it is that we get through philanthropy, hopefully more, that we can address those even more successfully because we've created these efficiencies. But then we have that issue about how we're communicating what we do when it's suddenly gone from our local hospital, where I felt like they were family, to a system, which actually might bring us more value, but how are we communicating that? So what is it like to be inside a healthcare environment where you do have to communicate with people about the importance of this to them? It's about them. But your life on the inside is trying to make all these pieces fit together to create the efficiency so you can be there in the first place.
Yeah.
What's going on with all these mergers, and how are they dealing with that communication?
I think it's really difficult. I think whenever there's a change in an organizational structure, people don't like that. People don't like change on the inside. Most people sort of avoid change if they can help it. Right? I mean, that's just the case. However, change is how it's going to be in healthcare, whether it's mergers and acquisitions, whether it's changes in reimbursement, whether it's changes to the rules, all of that has been going on for some time, and I think is only going to continue. So we've got to be comfortable with that change. In terms of the way, though, that I hope, and we heard a bunch of it in different sessions across the last couple of days, I hope we think about change is that it's an opportunity. And that whether it's an internal issue because of a merger, what's the opportunity? Where can you grow your own career in that process? How can you figure out how to do things that maybe you would never have had the opportunity to do because there's a vacuum, and you can step into it and you can really do something different? Dave Flood was here and said yesterday, nobody during a merger environment, nobody says, oh, maybe you just shouldn't do. In fact, it's, go do it. Whatever it is, go do it. If you see something that needs to be done, go do it. And I think one of the things that we worry about is that communication to donors. How do we talk to our community? How do we talk to the donors about this? And again, it's an opportunity. Hey, you know what? The care that you get right here is going to only be better as a result of the fact that we've got more resources, more experts, more ways to take better care of people. And if you give to your local hospital, it stays local. So we've always got to sort of make sure that we reinforce donor intent. On the other hand, you might care a whole lot about Alzheimer's research. Well, guess what? As a system, we're going to be able to make much bigger strides there than we would have as an individual hospital. And so there are ways, I think, to talk to donors about the benefits of the local, staying local, and the larger system impacting things that they care about too.
Right.
Yeah. Definitely there are a lot of efficiencies and ways, paths to effectiveness that come from systemness, from mergers, from acquisitions. But one of the particular things that I think we have to focus on as the philanthropy team is trust. We know that many donors say that their trust in healthcare has eroded, their trust in nonprofits has eroded, and that having trust in an organization is fundamental to them to make their best gift. And so as the philanthropy leaders in our organizations, where we have built relationships that were founded in values and virtues and love of community, we need to appoint ourselves, in some part, the guardians of trust. We need to steward our donors to show them how our commitments have not changed, that the structure around us has, but the way we want to show up and the things we want to do have not been affected by this merger, this acquisition, this systemization. Because I think people want to still know that we are going to be true partners with fidelity to achieving the good that they intended to lift up their community. And so I think that's a really key part for us. Safeguard trust. Be the guardians of trust.
This is a big issue for obviously all of you in terms of communicating that you're trusted partners, and all of you've all done that very effectively at your organizations. But this does seem to be one of those headwinds that you talked about earlier. And I didn't ask you to name the current headwinds. Betsy, you did talk about a big one, which has been there for a long time, which is getting the CEOs on board with us. And now you're talking about something which seems to be increasing in importance, which is addressing these mergers in light of the value they bring to the community rather than the efficiencies they create. Because as you say, this is not about our need, it's about the community's need. But what are the other headwinds maybe that are really truly new or are blowing up? And maybe trust is one of them. So maybe I can just ask each of you that question. Just what are some of the headwinds right now for healthcare philanthropy?
Yeah, I mean, I think trust is such a, like, just going back to that, I think that is like also very personal too, like where you decide you're going to, take care of your health is you're gonna trust in that provider. So having the trust resonate within the team and the leadership, like that's all critical. And I think it kind of leads into some of the technology questions that we've had also, especially surrounding AI. There's a lot more focus right now on, the governance of it. There's a lot more focus on cybersecurity, which is wonderful because we're hearing, people are taking it seriously. They're starting to really understand, what the implications are, and they want to make sure that they have best practices in place, to one, honor their patients and their donors, but also, maintain that data integrity. The challenge also is like, you want to make sure that people see the value that comes from that too. So you might still have people that are hesitant about embracing the technology, but you need to be able to see, okay, well, how do we bring this into our organization safely, and then actually be able to see the ROI, to see that demonstrated effectiveness. Because again, it goes back to, these issues of burnout. It goes back to the issues of having to do more with less. How do you, make the goals that you need to make without having just too much red tape? And I think, there's definitely a balance there. So I would say like that's definitely one of the shifts that we're seeing, and it's all very important and very serious, but you got to keep in mind, what is the goal that we're trying to accomplish? How can we make sure that we're getting there?
And just as a quick follow-up on that, because this is really important, but the language we're using, I know sometimes it really informs people who are already introduced to the topic, but other people may say, what does that even mean? So can you give a quick example of why the introduction of AI is important in this discussion for healthcare philanthropy? And what benefit does it offer? But also, what is AI governance in this context for those who've never even heard the term or thought about how it applies to them?
Yeah, well, we don't have AI governance in our policies in the government, current federal government. So sorry. And then internally in hospitals, that's like where they're actually putting around some, best practices, like what can happen, what can't happen, where are the models coming from, the transparency, the trust, in the data that is being used. So
more than guardrails.
Yes, much more than guardrails. There's regulations that are determined oftentimes by a committee. There's the Fundraising AI Institution that also has, their set of best practices, which is a great way to get started. I would say, when we talk about AI helping organizations in their fundraising, it could be, helping with automation process. It could be the generative AI components, helping with your emails, making sure that the information is getting out to the right people at the right time. But, what we're seeing at the DonorSearch team, where there's like truly impactful results, is being able to tell folks, what donors are ready to give right now and what are the different signals that will, bring that person to the top. And one of the really exciting things is we're hearing from people here at the conference is they're confident, right? They feel, motivated and excited by the results that they're saying. And you hear somebody say, we got $2 million after 6 months of using the tool. And it's like, holy cow, that's amazing. And now they're ready to move forward and they feel like they've overcome a lot of challenges. So that's like one of the examples.
Sure.
Yeah.
No, thank you. Alice, you were the one who used the term headwinds.
Yeah.
But I know that you have probably named at least a half a dozen right now, but what are some of the ones that are really unique to our time?
Well, I think one of the ones that we have struggled with before, but it's a big deal, and I do think AI plays into it in a possibly very positive way, is staffing within the healthcare philanthropy universe. True as well in the healthcare sector. We're going to be 100,000 healthcare workers short in 2028. So it's not just philanthropy that is having this problem.
Where are the shortages? Because we've talked about nurses
doctors,
before,
nurses,
cardiology.
Across the board. Yep, everywhere. But I think when you think about healthcare philanthropy, what you say to yourself is, if we're going to be an increasingly large engine for diverse revenue streams coming into our hospitals, we need to have really great people out there in front of donors. We need to have great people who are the ops engine behind what we do. And that's not always been true. I think we've had shortages. We feel like, you know, we could have lots more people. We're working at that in a variety of different ways, but it's important that in a moment when we're seeing budgets likely going to be cut and other sort of financial pressures from the hospital side coming in, that we protect our teams. We talk to our teams about resiliency, that we work to try to keep the people that are already in seat rather than losing them and having to try to find something else down the way in order to sort of bring new people back in again. And Sarah's point around AI, you know, one of the things that AI can do for us is allow the people who are on our teams to be more efficient. We did an AI conference a couple of months ago, and I kept hearing over and over again, you know, AI is not going to replace any fundraiser, but the fundraisers and the professionals who understand how to use AI are going to replace those who don't.
Right.
And I think in this sector, in this universe, what it's really about is, can we get efficiency so that instead of trying to grow a budget in order to grow a goal, we can do things that allow us to raise more money with the people that we have.
So staffing is a big one, and you explained why, but let me ask a really, really dumb question.
Yeah.
Why is there such a financial problem?
Oh, okay.
What is the pressure right now?
So
I think
there
you
are
talked a lot about
lots,
this
right?
morning.
Yes. So there are revenue pressures. Biggest one there is the payer mix. The fact that we are moving 10,000 people a day from private insurance to Medicare.
Right.
That means we get 50 cents on every dollar for any a procedure or any stay that one of those patients makes. We used to sort of be able to balance it out. We'd have seniors who were on Medicare. We would have younger generations who were on private insurance. That balance, because of how big the baby boom is and how small in relative proportion Gen X, Y, and Z are, means that we just can't balance that anymore. On top of that, we're talking about Medicaid cuts coming as part of the HR One Big Beautiful Bill Act. Those are not supposed to take effect until sometime toward the end of 26, early 27. But we're looking at $880 billion over the course of 10 years of cuts there. It's likely to impact roughly, I think the number is about $650 billion across our own reimbursement dollars coming in across those 10 years. So that's a big number. You've also got the impact of tariffs, where there are some estimates that say that tariffs are going to raise our expense lines 20 to 30% over the course of the next several years because of all of the inputs that we get from lots and lots of parts of the world, all of which are about to be hit with even higher tariffs. So there's, and then the staff costs, we've raised the dollars that we spend on staff, not just in philanthropy, but across healthcare, $42 trillion over the course of the last several years. And as I mentioned, we're going to have a staffing shortage. What we're going to end up having to do is pay people more in order to keep them in seat, because there's going to be a bigger and more intense war for talent. And one of the ways to get somebody to move from one hospital to another is to pay them more. So we're going to see a lot of pressures both on the revenue side, lower revenue, and on the expenses side, higher expenses. And when you're talking about margins that on average before the pandemic were 3 to 5%, during the pandemic there were lots that were underwater. We're now at about 1.9% across the United States. Any one of the things that I just mentioned could take points off of that margin. And at some point, we're going to be looking again at margins that are significantly lower. During the pandemic, what that meant was that we were told, alongside every other part of the hospital, that we needed to cut at the same amount. So 10% across the board, it's going to be, everybody's pain is going to be the same. And, you know, and sorry, foundation team, we get it that you guys raise money, but you need to cut by 10% too. Right now, I'm not hearing that. Right now, what I'm hearing is, the rest of the hospital is looking at where to cut, but we understand that if we cut the philanthropy work, we cut revenue. But at some point,
there is an understanding of that.
Right now, that's what I'm hearing. It doesn't mean that by 6 months or a year from now, that's not going to have inverted. I do wonder whether once the Medicaid cuts, assuming they actually do happen, that we're just going to have to figure out how to do more with less there too. But the reality at the moment is we're holding, in most cases, we're holding the ability to keep our fundraising teams in place. But it's important that we are able to explain to our leadership, when you invest $1 in the work of the philanthropy team, we return $4.50 on average.
Okay.
There's nowhere else in the hospital, not even ortho, right, where we're making that kind of a margin. And so being able to talk about that and being able to say, listen, if we, bring in an extra $1 of philanthropy, it means we don't have to find another $75 to $100 in gross patient revenue in order to have that same margin number. Those are the kinds of conversations you have to have with your financial colleagues as well as the rest of the leadership in order to get them to understand why they should continue to invest or at the very least continue at the level that we're at rather than cutting. We've got some slides. We're always happy to help. So there's a joke in my office, which is that there is a particular slide that will end up on my tombstone that has several of those points on it because it's always in every presentation.
Coming soon to a cemetery near you.
Yeah, exactly.
The
Right?
PowerPoint.
Hopefully not too soon, though.
Yes. Wow. Well, I'm almost sorry I asked that question, but I know that you seriously described the headwind, but you gave some opportunity though for some good news there, just as you've done. So Betsy, what about you? What are the other kind of unique headwinds of this time, and maybe some light at the end of the tunnel for those headwinds?
Yeah, I don't know if there's a lot of light at the end of the tunnel. It might be a train. I think there are some real and present threats to generosity. We've seen the number of households participating on an annual basis declining. It dropped below 50% of American households making a charitable gift about 3 years ago. We've seen the percentage of annual kind of household income drop what people are giving. We see donor renewal rates are declining. We have a lot of places of vulnerability. And for very understandable reasons, many healthcare organizations have indexed very heavily on pursuing major gifts from individuals because we've needed to maximize our revenue. We've been under pressure to deliver dollars. But what we've simultaneously done is we've shifted our attention and our budget to major gifts. We have ignored building pipeline. And so we are not doing a good job in many organizations identifying and engaging those new smaller donors who could have the capacity and interest to grow with us. And so we've got to get to a point that we're not continuing to decrease the size of the pond that we're swimming in by failing to bring new people into the pond. So I think we've got a lot of things that are very specific to just who are we talking to? How are we engaging them? How are we growing the number and quality of our relationships? Because generosity in America, unfortunately, is declining. And there are many donors who are saying, I'm stepping back because I see others stepping forward. I am very grateful for folks like, Mackenzie Scott, who are stepping forward and doing big things. But when we have 5% of total charitable revenue in the United States driven by about 6 individual donors, we have vulnerability.
That's not sustainable.
It's not. We're letting our boat base erode. We've got a sandcastle. The waves are coming in and chipping around it, and we haven't sounded the red alert yet. And it is time for the red alert that we've got to make sure we are building a vibrant and sustainable pyramid of donors who are participating at all levels, and that we are fostering that engagement to overcome that decline overall in participation, decline in size of gifts, and all of that. We're going to be in trouble. We are knowingly driving toward a cliff, and we are not trying to figure out how to adjust our course.
Wow, so all of you are really bumming me out today.
I'm sorry. I'm sorry.
No. I think, but there is always an opportunity in each of these things, and it's embedded in all of your answers. But maybe some of it was also embedded in this conference. So what I'm about to ask, by the way, we didn't preview these questions. This took on a life of its own. So thank you all for going with me on this. But for those who are watching this either live or watching the recording later, what I would like to do now is just ask about what we're hearing from colleagues throughout the field of healthcare philanthropy at this conference that gives us some hope in addressing some of these headwinds. This is not an argument for not attending this conference. I just want to make that clear. We're giving you a tiny 1 hour window on what's been going on for several days. So since these issues are so huge and manifest, and they will not be resolved in the next 11 and a half months, this is also an argument for joining the party next time, because it's not just a chance to meet colleagues, it's also a chance to find answers to situations which are truly unique to our time. But let me just go ahead and just ask whoever would like to take it first, what's something you're taking away from this gathering that is giving you hope? Maybe that's a specific set of instructions or ideas that you can bring back to your office, the office of your clients, so they can take on these headwinds.
Yeah, all of the things that you two were just sharing, like, again, it goes to this theme of the AHP conference is the resilience, right? No one likes change, but change can spark the innovation. It can spark, better ways to do things. And you have all of these different pressing challenges that, it will make or break some people, right? And those that, can look to their leadership, that can get the folks involved and create the strategies that'll take them to the next level. Like, those are the ones that are going to be bigger and stronger when they come out of it. And I think, no one, what is it? No pain, no gain. I don't really mean that in this instance, but but I do mean the fact that you can come out of this bigger and better. And we saw this with COVID too, right? Organizations that didn't modify their strategies, maybe it was events focused, maybe they just stopped doing everything all at once. They didn't make it through. And the ones that did change, they created these brand new strategies. They were able to raise more than the last, the previous year. They, were able to overcome so many different challenges. And I think that speaks, to the resilience piece. And yeah, if you have been doing things the same way for so long, and you're not changing, the chipping away at the sandcastle, there won't be anything left, and you do have to fill that portfolio. So I'm, a big believer in, you have to take action. You can't just sit and wait. You can't wait for something lucky to happen. You have to make your own luck. So I think that's been really exciting, listening to people that have done something new, that have actually embraced either new technology or new way of looking at things.
And Sarah, just as a quick follow-up to that, it sounds like, because you're also touching on the sandcastle analogy, that these are solutions you're hearing from people in small hospitals, big systems, which apply to not just the top, but across the base, right?
Absolutely.
For people who are getting care today, who might be able to help tomorrow.
Yeah, absolutely. Yeah, it's all of the different, I would say departments within the organization. You need to look at your annual fund, major gifts, your plan gift, take a look at who's on your team, what is really holding you back from getting those big wins. Is it a mental challenge? Is it an actual physical challenge? Is it secure, your IT team? What is it? And try and overcome that, get the people involved that can actually, overcome that. Maybe it is your team lead or your CEO, or maybe it's somebody you meet at a conference that knows how to speak to CEOs or the C-suite. And it's just sort of thinking outside of the box, I think, to get there.
Right, and it does seem like in the exhibit hall, which is another feature of these conferences, if you haven't attended one, it's not just people selling products, because they do. I mean, if you don't have vendors, you can't have a conference. But it's also people talking to the various service providers, and that's feeding the design of products and services that then can help us to do this work better. So it's very interesting to see in the hall some of the solutions that are being developed right now that are finally addressing this sandcastle problem, which is a great way of thinking about this. What about you, Alice?
I have been, and I hear this not only at the conference, but across my travels as well. People are reporting quietly, almost like they're afraid to say it out loud, that they're having their biggest fundraising year ever. And when you say, okay, so peel back the onion, why? What sort of comes next is, our donors and our volunteers recognize that it is a moment to lean in. They recognize that it's a moment when we need more help rather than less. And where maybe, it really does take a village around the outside of our healthcare organizations in order to protect us as we go forward. And one of the sort of, you asked, where there were specific things that you could take away. one of the things that I've heard a bunch, we do an executive forum sort of before the conference where it's just the chief philanthropy officers, the chief development officers, but I've heard it throughout, is think about how you can get your boards and your other volunteers engaged in talking to your local or state officials, whether you can get them talking to even sometimes at the federal level, some of those folks, because in addition to the dollars, they also have a lot of influence, and there may be ways that even their ability to talk to people who are making regulatory decisions in one way or another, legislative decisions, they're going to be able to influence the outcomes for us at a very different level, even than if they were to be nice enough to give us a check. And so I do think people are leaning into this space. And the other thing that I always see, and it always makes me so happy, I feel like it's one of the great benefits of AHP, is not only do we have volunteers who are leaning in to help us, but this community is constantly ready to help each other within the AHP membership. And so the other thing I will say is, those of you who were not able to make it, if there's anything that you're struggling with or working on that we can help with in any way, we're always happy to get email and see what we can do in order to connect you with people that might be the ones that can help you.
And there are a lot of those people within the membership, certainly,
sure are.
and leaders within the field who have been ushering AHP along with you along the way. A quick follow-up: when you started that description, you said they're almost shy about talking about the success. Can you talk about why, and if you think that that's merited? In other words, should people be celebrating this success, or is there danger in it, or is that danger overwrought?
I think the reason is because we recognize how much more pressure there is. Mm-hmm. And so it's almost like if you whisper it instead of shouting it, then maybe you don't jinx it, right? It's sort of that kind of a feel. That having been said, it is critically important, on the one hand, to lean into that success with our executives when we're looking at budgets, when we're looking at strategic plans, and be able to say, I know, because we monitor the data, we recognize what the KPIs are, we understand what we're looking at, that there are going to be ways for us to contribute, maybe even more than we have historically, given the data that we're seeing. On the other hand, I think it's also really important not to think to ourselves, well, gosh, if we had a 10% increase in our results this year, that means that we should be able to do another 10%.
Right.
It needs to be quantitatively rigorous, because the last thing you want to do is promise a goal that you can't meet in a moment when every dollar that comes in is so important. Mm-hmm. And the process of budgeting and thinking about how we do what we do as a system, as a healthcare system or a hospital, requires us to be really good at understanding what we can expect. So I think it's great to celebrate it. I think it's important to say thank you, both to the teams as well as to our donors. But the only worry I have is if there suddenly becomes this expectation that 10 or 15% bigger this year means 10 or 15% bigger next year. It doesn't always hold.
Yeah. Mm-hmm. Especially if your budget doesn't increase.
Right. Yeah, exactly.
Yeah. I want to go to another facet of that. Yeah. I think whispering about our success is also a product of the current environment. Mm-hmm. I have the privilege to write for the American Hospital Association, and there have been a lot of conversations of late around the questioning of hospital nonprofit status. Mm-hmm. And so there have been CEOs who are reticent to get out and talk about our success in attracting philanthropy because they're afraid in some way it will erode our credibility as nonprofit entities. And so there are organizations that have pulled back on announcing big gifts. And I think that's absolutely the wrong thing to do. I think we must step forward and say, our mission and vision are powerful enough that we have attracted the support of others. The reality is that we must continue to attract revenue through philanthropy or other means that will allow us to grow and innovate at the pace of the needs of our community. I think we need to show that when philanthropy comes in our door, it better enables us to deliver upon the community benefit that is part of our social contract. And so I think that when we are attracting significant support, it is something that we should be illuminating as part of what makes us a valuable nonprofit organization that is worthy of the support of others. And so I did just write a piece for the American Hospital Association Trustee Magazine that is out there. If any of you are running into that headwind or that brick wall, because I think as part of the conversation, we need to not be quiet. We need to be proactive in talking about the power of philanthropy as one of the most meaningful forces for good in healthcare.
Yeah.
And hopefully Jack can put a link to that if you can find it in the chat. So look for that, or we'll put it in the show notes as well. Thank you, Betsy. Appreciate that. I want to make sure that we give a minute in case there's anybody who's here with us live that has a question. So if you see any, Jack, please feel free to feed those to me. But I'm sure that most of you are just listening and thinking, well, how does this apply to you? And maybe that's a good part for us to ask this question, which I did prepare earlier, so you may have seen it, which is the future, it's a fill in the blank. So feel free to do this as a Mad Lib or any way you wish to do it. But it's the future of healthcare philanthropy will belong to organizations that, who wishes to take that on?
I'll jump in.
Okay.
The future of healthcare philanthropy will belong to the organizations who perceive that the most powerful cases for support will exist at intersections. It is no longer going to be about raising money for the Women's Institute and the Metabolic Institute and the Cardiac Institute. It's going to be about how we can leverage our insights around metabolic health to improve the cardiac health of women. It's not going to be this and this and this. It's this times this times this. And so I think looking at those opportunities at intersections and in interstitial spaces is going to be incredibly powerful. And we've got to look at the fact that there are going to be some platforms that enable many efforts. Artificial intelligence, genomics. Think about all the things that become through lines and threads that we ought to be thinking about lifting up those things to lift up the overall capacity of our healthcare organizations. We have tended to raise money in discrete silos, and that is not going to be the way that those who are best in class raise money in the future.
So just a quick follow-up then. How do we get our institutions to think that way so they can talk that way? Is this a matter of breaking down our internal silos? Is it a matter of a meeting where they all come together and have that big powwow and say, what is it that we're doing here? How can we do the multiplier effect?
Yes. I mean, I think it is a place we've got to have proactive conversations with executive leadership in our healthcare organizations, because right now they're not thinking about it. I find most organizations do a very poor job articulating what their strategy is that is going to be worthy of investment. And when they are thinking about it, they're thinking about it service line to service line to service line. They are not looking at the points of synergy and acceleration. And so I think we have an opportunity to talk to executive leadership to say, this is where the most powerful story exists. How do we come together and look at how things interrelate, how they leverage each other, how we can create something that is unique and powerful that leverages the capabilities of many endeavors within our organization. We may have to be the one who sparks the conversation, who drives a greater form of imagination. And I think that's a great role for us as philanthropy leaders, because we will often be the conveyors and interpreters of vision to those who are outside, but vision must come from those who are inside and the top of our organizations.
Yes. Yeah, thank you for that. Okay, so again, the future of healthcare philanthropy will belong to organizations that?
I think my answer to that is define themselves differently. So somewhat drafting off of what Betsy just said, but also thinking about it differently. There are all kinds of examples all of a sudden of hospital foundations that are now partnering around big issues with lots of other organizations in the community. And that's not something we used to do. And it's certainly not something we even mostly now do well. But this moment, when you start thinking about the kinds of cuts to the social safety net across not just healthcare, but also food insecurity, housing insecurity, every single sort of component of the social determinants of health means that if we don't figure out how to not try to do everything, not try to raise money for everything, but work to connect with other organizations who are good at what they do and figure out how we support them and how they support us, we're going to have, just to be sort of Machiavellian about it, if we don't do this, we're going to have patients who come through our front doors who are sicker, who have significantly greater headwinds of their own because they're not going to be able to get better and stay better as a result of those social determinants. And they're not going to have the insurance that we need in order for us to be able to stay afloat because they're going to be under or uninsured. And so when you think about all of that, you say to yourself, gosh, what can we do to build a communal safety net around people who are particularly vulnerable in a moment where the organizations that have been doing that separately and sort of in silos are now also vulnerable from a funding perspective? What do we need to do? What kind of leadership role can we take? It doesn't necessarily mean that we're the ones throwing all of the money into it, but foundation teams, philanthropy teams can help in figuring out ways to build that resiliency across the entire social safety net. There are all kinds of examples of this. We highlighted a couple of years ago, Vail Health, who did an incredible campaign within Eagle Valley around behavioral health, and they brought in 40 other organizations. The campaign was across the entirety of those 40 organizations. Okay. And so what they were able to do was provide some of the backbone, some of the support, some of the back end office stuff that then allowed the rest of the dollars to be put into everything from preventative around behavioral health all the way through to post-acute. That's one example, but this morning, Inova was talking about the work that they're doing within their own community health clinics. Alameda was talking about the fact that they were already trying to figure out how to raise money to have some sort of liquidity in a system that, or in a hospital that they're acquiring. Meanwhile, the biggest gift to that effort came from another healthcare system that's a much bigger system and actually has nothing to do necessarily with the work of Alameda, but they recognize that the safety net needs to be there in order for them to continue to do the work that they're doing with their own patient load. So I think we're going to see cross opportunity, and we've got to be aware and ready to be a part of it and to be even to take a leadership role sometimes.
Thank you. Yes, we're not alone.
We're not alone.
We're not alone.
And we shouldn't do it all. I mean, I think that, historically we've sort of said, we're the big guy in healthcare in whatever community is that we're in. That doesn't necessarily hold anymore. Or even if it does, it only does if the rest of the safety net around us is able to help us with that.
Right, which is increasingly difficult, as you were pointing out before.
That's right, yeah.
So Sarah, same question, fill in the blank.
Listening to both of you, I think it goes to what my initial response was. It belongs to us, right? And I, not to sound like a cliche there, but it belongs to the people that are going to be brave. They're going to be confident. They're going to explore new ideas. They're going to embrace the change. And it's so critical and so important that even in your individual roles that you are thinking about it like that, because it's across departments, right? It's across different healthcare systems. It's almost on every level. And over time, if it continues on this trajectory, every person is going to count, and making sure that we're reaching those goals, that we're making those KPIs. And so I think, it's really important that, if you're listening to this, if you're an attendee of AHP, that you really, figure that out internally. Like, how am I going to overcome these huge burdens? So that way, we have these great healthcare systems for our family, right? For your children, for your grandchildren, because we are, a great nation with wonderful scientists, wonderful medicines that can do, amazing things to heal us. And I think, it really, we're held accountable at this point, and we need to make sure that we're doing everything that we can, and we got to get out of our comfort zones and, collaborate with one another, hear the best practices, because that's really everything that we've been talking about is like we can't do it alone. And some of these really great success stories are coming from, things that are new, the innovation that we're seeing either in the tech space or even just how we're working together.
Yes, thank you. Thank you for that. We had a question, the housekeeping question, just to address it for those who might be interested. The CFRE credits that are provided through this series, you would contact CFRE about that. However, we do have a form I believe we received from CFRE, so you can contact me directly. We'll put my email address in the chat, but I'll read it out as well, so you can contact me about that. That's Jay, that's Jay, at DonorSearch.net. We'll be happy to help you with that. I want to ask you a final kind of 30-second question as we close today, and it's kind of a personal one. You all are not just healthcare philanthropy leaders. You're also people who are donors, and you've been patients. So if you were speaking to a hospital, healthcare system to which you'd contributed and or have where you've been a patient, what do you want them to hear? What do you want them to take away from a discussion like this one? So they internalize it and they treat you the way you think every patient, every donor should be treated.
So I think a lot of what happens when you're inside a hospital is you forget that you are also sometimes a patient or a donor. I think we need to make sure that we are sharing the stories of the great stuff that's happening. Not we're the number one fill in the blank service line provider of blah, 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 but instead, this is the transformative stuff that's happening and why it matters. I think the way you connect with a donor and a patient is by making them see what the other side looks like. The incredible stories of doctors and nurses, the incredible stories of patients that become donors. If we can share those stories, it inspires people to come and get care, which is great, but it also inspires people to say, how can I invest? What can I do?
I would kind of draft off that, and that, I think we've always got to recognize that healthcare is the fulfillment of a sacred trust. Mm-hmm. People are entrusting us with not just their bodies, but their hopes. Mm-hmm. And I think values and virtues always need to be a centerpiece of healthcare, whether you're experiencing it as a patient or as a donor. And so I know we all know that philanthropia comes from the Greek around a love of humankind, but love should be the through line in everything we do. Love to lift up the health, the well-being of the humans that we have the privilege to care for, physically, mentally, socially, emotionally. All of us should be working together to enable people to holistically have a good, whole, well life.
Got me very emotional, actually. I was just thinking about just a different experience that I've had in the healthcare system. And one, of course, was when I recently had my baby, and you are the most vulnerable you can ever be in a situation like that. And, never goes according to plan when you have your first child. And afterwards, I just remember the care that I did receive from the nurses. And it was, something that was wonderful. Like it made all the difference in the world, because again, it's just like it is the hope. It is, a life-changing experience sometimes when you're in the hospital system. And you will never forget the people that treat you with the utmost kindness, and you'll never forget the people that didn't. And I think that's something that, again, like when you talk about the whole fundraising, you talk about technology, you talk about, all of these different changes, like it is, we're all going to be in some sort of healthcare system at one point or another, and we want to make sure that we're having the best care, and that's like so critical. So I think I answered your question.
Yes. We all have this experience. I think what's great about this is not just learning in this environment with AHP about how we can be better at what we do, communicating what we do, and prepared to do more of it, to be resilient, but also to get in touch with who we are as patients and donors, so we can see that too. And so I thank you for not only sharing all your knowledge and what happened here at the conference, but also your personal experience. It's very, very important. And thank you to everybody who was with us live, those who are watching the recording later. Again, this recording will be available for you on the DonorSearch site under the resources tab. Again, that's at donorsearch.net. Where you can find hundreds of these programs, plus on the DonorSearch YouTube channel. So check that out, and you can subscribe there as well. Plus, you can check out our other 2 series on Tuesdays, our Frontlines of Social Good show, that's News and Views, where we'll cover some of what we learned here on Tuesday. And on Thursdays, of course, How to Raise, and then we drop our podcast on Fridays. And I want to make sure you listen to Betsy Chapin Taylor's episode. It is a very moving one. You can check that out wherever you like to listen. My thanks again to Sarah Tedesco, Betsy Chapin Taylor, Alice Ayers. I guess I did that in reverse alphabetical order this time. I was trying. Thank you all very much, not only for this, but for everything you do to keep us all healthy and making sure healthcare really succeeds in this country.
Thank you very much for having us.
Thank you.
Yeah.
Thank you, Jack.
All right, that was fun. Thank you.
No, I didn't know I was going to get it. That was so crazy.